here what I've done is stacked all the Filtek colors. So you've got white dentine, which is really opaque from the XTE. Extra white is that special shade I'm going to talk about a bit more from the universal colors. You've got extra white body, B1, bright from the Easy Match and A1. Now the extra white body and white body from the XTE, sometimes they're a little bit too. It's what I've been using a lot for these, or not a lot, but a bit before until recently. But they can, again, they're just a little bit too translucent. I'd rather somewhere between the dentine and the body, and this is where this extra white color is really good from the universal shades. Okay, so the Filtek universal shade is a real crowd pleaser. That extra white, it's just a bit more opaque than the body, and it's less opaque than the dentine. And I guess that's why they developed it for this demographic, this group of patients that want that. And I just highlight it here. It's one area where I really use this universal shade. Here's a case I just done recently. So lots going on, to be honest. There's a cant, there's diastema to close, there's big class 4. So we strip it all out. And for me, it's going to be super challenging to layer this. So I want to use a single shade. Patient wants them to be really bright white and very clear about that. And they've tried whitening and they get quite sensitive. They couldn't get them whiter. They want them white. So again, if I use this quite opaque color, it's going to be great because it's going to hide the class 4 because it's more opaque, and it's going to hide the blends, and I can do everything else. So there it is in. And in some areas, this is really thin because it's reasonably opaque. It hides the transitions quite well. It's not a perfect case by any means, but it works quite well. And it's a real crowd pleaser, this extra white for patients. So it's my go-to for any of these patients that are coming in wanting kind of composite bonding to almost to unnaturally whiten their teeth. I don't do a huge amount of this work, but I think it's a good color for it. It's the pre-op and the post-op. And then I guess the main thing was closing the diastemas and all those class 3 cavities we've got.